Wonderful. Thank you all so much for joining. For those of you that don't know me, my name's Catherine O'Mahony, and today I'm really looking forward to sharing with you the On Q Recruitment 2021 Salary and Job Satisfaction Survey, and specifically the top line results as they refer to clinical research. So this particular webinar is focused to people who are very interested in hearing more about what's been happening in clinical research. I would just like to say we are recording this session, and a copy of this webinar will be sent to you later today with a copy of the full salary and job satisfaction report. And of course, therefore, if you need to watch it again, you can, but hopefully you won't. We've set aside about 60 minutes. However, my presentation runs for about 25-30. And just like to draw to your attention that there's a chat function. And please feel free to ask questions. As I mentioned a few moments ago, unfortunately, I won't be able to see the chat function when I'm in presentation mode, but my colleague Miranda can interrupt me if there's anything critical or not working, but we'll hopefully have loads of time at the end. So I really look forward to hearing what you're going to say, what you want to know. And of course, today's session's all about helping yourself or helping you guys and what you want to know about been happening. Before I begin, I'd really like to just thank all the contributors who've made this survey possible. We're now in our 16th year, and it's only possible because of the consistent contribution by people in the industry and support from people like yourselves. If this is your first time listening or joining to an On Q webinar or looking at our report, I'll just share with you the data is collected anonymously over about an 8 to 10 week period. And in addition to capturing data on job salaries and REM and benefits and job titles, we also ask contributors to share with us their information around job satisfaction, engagement. We also ask people, leaders and managers to give us their insights on what's happened in the past 6 months and what they predicted they were going to do in the next 6 months. So a copy of the report that you'll get later today will be emailed to you. We'll cover a plethora of topics: remuneration, increases, bonuses, sign-on bonuses, the employee experience, reasons for leaving, staying, hiring talent, why people are looking for new work, how recruitment's been going for people, and what, living with COVID, and what the hiring preferences are for living with COVID, and what people's preferences are going forward, and finishing off with well-being and work. Wonderful. So hopefully this will work. Excellent. So as I mentioned, the survey ran for about 8 weeks, and that was opened up on the 8th of June and ran until the start of August. So that meant that it covered people in New South Wales who'd gone into the second lockdown. So 50% of people that contributed had opened, and the balance was contributed, and their thoughts and how they felt and what they were feeling was during the second lockdown for New South Wales. And of course, Melbourne, who's the second biggest geographical contributors, also were in lockdown as well at different stages. So what are we looking at here? This particular slide just gives you an overview of the demographics. You can see that we've got a range of people from small to large companies. You can see the gender split was about 60+% for females, 40% for men, and about 60% of the contributors work for an international company and 40% are Australian owned. So what about remuneration and pay increases in the last 12 months? I think there's been an awful lot of talk in the media and also in life sciences, and most specifically in clinical research, about what's been happening with respect to pay rises in the past 12 months. This particular slide talks about all sectors. 64% of all contributors indicated that they'd received a pay increase in the previous 12 months, and the average pay increase was split evenly between 1 to 2% and 3 to 4%. I think what was interesting was some pay rises in some companies were still on hold or frozen due to the COVID pandemic. Some people received no feedback as to why they didn't get a pay increase, and some people indicated that it was inadequate company performance. But what happened in clinical research? Well, in clinical research, over 76% of all contributors received a pay rise. So that's positive. I will talk about on this next slide what actually happened with the pay increases for clinical research. In the past 12 months, 35% of the contributors got a 1 to 2% pay increase, and 3 to 4% got, or 32% got a 3 to 4% increase. This was up from last year. In 2020, 40% of people got a 1 to 2% increase. So what we've seen is a shift, and more people this year got a higher pay rise, and also in that 5 to 6 and 7 to 8. So there's definitely some increase there. I think what was interesting was when you look at out here, nearly 9% of all people got a pay rise of more than 10%, of 10%. That's usually when we've drilled down on that on previous surveys, that was usually due to internal promotion. So what happened about sign-on bonuses? Well, bonuses and sign-on bonuses, I think were very much one of the most common topics I got asked about, or we got asked about at On Q Recruitment, in terms of recruiting talent, particularly in clinical research. In terms of the whole cohort, 60% of all contributors received a bonus last year, and 10% were offered a sign-on bonus when they changed roles. And there was also the introduction of what we probably saw, particularly to the clinical research sector, was loyalty bonuses amongst some of the CROs. In terms of bonuses compared to the previous year, it was up. So about 59% of people got a bonus. I think in terms of the war for talent, we thought we'd see a higher number of people getting a sign-on bonus when they changed roles. It was sitting around 10%. And obviously one of the benefits of offering a sign-on bonus is that you're not permanently increasing your salary, but it's recognition that they're changing jobs and they may be losing a bonus when they're changing. The most common sign-on bonus sat around $10,000, but it ranged from $5,000 up to $15,000. The majority of companies did not offer an employee loyalty bonus, and those that did, it was less than $5,000. Overall, international companies were more likely to offer a sign-on bonus, 12%, compared to only 5% of Australian-owned companies. So to the all-important clinical research data on salaries. If this is your first time seeing or receiving the On Q salary report, I just wanted to take a few moments to explain what you're looking at. You'll receive, this is the first page, and this is what we call the snapshot or the cheat sheet. This shows you the clinical research data by job title, by first quartile, median, and third quartile, and here in the right-hand column is the bonuses. You'll also see that we've got a key, and the top line is the data for 2021 and the data for 2020. Where there are gaps, such as clinical research team leader, that meant we didn't have enough data. If there are any job titles missing, it also meant we didn't have enough contributors to share that. I think what you, in terms of car allowances, about 37% of all clinical research contributors receive a car allowance in their salary package, and about 56% received a bonus. The median car allowance in clinical research, if people did receive one, sat around $19,000. In terms of pay increases, I'm going to talk about that a little bit later. But what I do know is that there was a lot of talk about what was happening, particularly with the clinical research associate job title and also with the senior CRA job title. I think it'll be interesting to note, and this will be probably the only detail I go into at this stage, is that you'll notice the medians for both the CRA and the senior CRA stayed consistent to last year. Anecdotally, my thought for that is that more junior people or people who were on the cusp of the clinical research community were hired and taken on as CRAs that, in the last 12 months that may previously not have been considered. And what we also saw, which isn't really borne out by the data, is potentially people getting promoted. And so what we'll notice is there's been an uplift in that senior CRA first quartile, and also a significant increase at the third quartile for senior CRAs, up from 140 to 153. So I think that gives you a sense. There was also the jump in study startup. We don't have huge numbers there. It's less than 5 or 6, but the upper quartile remained consistent about 120. But I'm sure you might have more thoughts and questions about this later on. When you also receive a copy of the report, let me just go to that. This particular, and this is for all the salaries, but this is an example of the clinical research one. Again, it'll be the total remuneration, excludes bonus, and these particular slides indicated by industry sector. It's no surprise that for clinical research, the majority of people work for either a CRO or an ethical pharmaceutical. And here you can delve into a bit more detail. You can see how many contributors we had for each job title. And if you work in medical research, academia, or devices, there's also some data that's split out and you can start to compare. So the pages there here talk about from clinical trials associate right up to clinical research manager, and then they finish off on the director and regional directors. So we've got some really good data there that you'll get a copy of and that you can delve into deeper. And by all means, ask me further at the end of today, or even when you get a copy of the report later. But it was very interesting that I think overall what we expected to see and what people bore out was different to maybe what people were saying. But no doubt it was definitely a challenging year for people. Non-cash benefits. I think it'll come as no surprise that during the lockdown, the working from home compared to previous years grew from 61% up to the benefit received 81%. So those people that couldn't work from home were in jobs such as laboratory operations or manufacturing where they had to attend. These particular slides talk about the most common benefits versus the benefits that are most valued by employees. This is consistent every year prior to the pandemic as well. Flexible working hours is still the #1 most valuable non-cash benefit, excuse me, and that's across all genders, as is followed closely by working from home. I think what's probably important to, if you're looking about what are your wedge strategies in staff retention or attraction, if your company offers further studies, that's highly valued, as is healthcare and compressed working hours. I think what's important to note is as offices are reopening and people are starting to return to offices now, is that we are definitely noticing there's an expectation from employees that they'll continue to have an ongoing working from home as expected in their lives are being managed around that, and we're seeing that as really almost like a non-negotiable. Okay, moving on to the employee experience. Apologies here if I'm too slow. What was job satisfaction looking like? Job satisfaction for the total cohort of contributors, over 1,000+ people, sat around 66%. This middle slide talks about feelings of job security and what was the breakdown of men versus women. I think in terms of clinical research, job satisfaction was very high. Either 76% of people working in clinical research were satisfied or very satisfied. So people are enjoying their jobs. So that means it's great from a retention strategy, but also difficult when you're trying to attract talent. And no surprises, people are feeling quite secure in their employment. So when you delve a little bit deeper, why did people leave their previous employer? 50% of people who indicated they'd left their previous employer was for salary and benefits, no surprises there. And then sort of equally followed by lack of job satisfaction, seeking a more interesting role, or either excessive workload. I think what's important here from a clinical research perspective, when we delve down as to why people would leave, #1 would be for salary, but in the clinical research cohort, excessive workload is actually #2. So it's something to manage, and it's very difficult if you're under-resourced to not also pass on the extra workload to your existing cohort. Why are people staying? They really value the flexibility in their workplace. They really value their supportive managers, and if there's opportunity for career advancement and development. So how is hiring talent in the past 6 or 12 months? So I'm going to share with you slides in terms of feedback from the contributors, but also what managers were telling us and what they're also predicting to do. Okay, so in terms of This slide, and you'll get this in the report, talks about people thinking of changing jobs? Have they applied for a job in the past 12 months? And if they did apply for a job, did they receive more than one job offer? And were they successful in obtaining a new job? In terms of overall industry, just less than 18% of all the cohort, all contributors were thinking of changing jobs in the next 12 months. And about 35% of all people were maybe. Over 38% of all contributors had applied for a job in the past 12 months, and nearly 40% had received more than one job offer. And 60% were successful in obtaining a new position. So what does that look like when we break that down by sector? Clinical research was not by all means fitted into the average of about 38% of all people who had applied for a job in the previous 12 months. You can see that people who at the more senior level were the lowest, then followed by regulatory and market access. I think what was interesting for us was that the outlier here was laboratory. So people working in that research and laboratory sector was very high. Over 50% of people who contributed had said they were looking for work. So we were blown away by that figure. And then I wondered what was unique about them. Most of them continued to go to work during COVID. And so that could have put added pressure on them. I'm hypothesizing because they may have still had to try and manage children at home, but they still had to attend their place of work. So 38% of clinical research professionals had applied for a job in the past 12 months. We asked, are you likely to apply for a job in the next 12 months? And all sectors, as I mentioned earlier, 18% had said that they would. I'll just quickly move on to the clinical research slide now. What did it look like for clinical research? So you can see here, clinical research was lower. So only 11% of clinical research professionals were thinking of changing jobs in the next 12 months, which is fantastic if you're a manager and you're concerned about retaining staff. And so 50% of people said no, they had no intention, which was higher than the norm. I think, and apologies for my writing here, I think that was unusually high, the risk of why 40% of people were unsure. And I think it's something to contemplate moving forward when we're reflecting on what would it be. They've got a high level of job satisfaction. The salaries, yes, they're moving, but what was it that would maybe make them think about changing jobs? Has it the fact that they've been remote and not feel part of the team? But when you see further as we talk, the engagement and productivity is really high from both the managers and non-managers have indicated. So I think that was really a question I really couldn't answer. In terms of what are managers telling us, the total cohort, 37% of all people managers are planning to increase their headcount in the next 12 months, and 36% are planning to have no change at all. This other slide talks about what were the reasons for turnover, and mostly it was resignation, followed closely by internal promotion. I think what we've noticed in terms of clinical research was that it was definitely higher for clinical research managers. Over 43% are planning to recruit permanent headcount in their team in the coming 12 months. I'm not sure if that's the same for you as well. So you can just see for clinical research, 43% are planning to hire permanent headcount in the next 12 months. There's an increase in the number of casuals or contractors, 15%. So very few contributors, and particularly in clinical research, there's no plans for decreasing, and 30% said there'll be no change. From On Q's perspective, we've definitely seen that as managers have found it difficult to recruit, there's been an increased number in independent contractors and casuals that companies previously would not have entertained. So how is attracting talent? Attracting new talent in clinical research in the previous 6 months, managers indicated it was more difficult. So it's overwhelmingly more difficult than normal, which is definitely been borne out by all our conversations. And when managers did go to recruit, over 75% of all clinical research managers had tried to recruit a position or more than one position in the previous 6 months. When they did go to offer, over 50% had had a candidate who turned down a job offer. And the most common reason was either accepting a job with another company or accepting a counter offer from their current company. It's really very hard when you get all the way down the end. And we saw other things happening that we'd never seen before this year. Clients telling us, and we experienced it as well, of what was called ghosting, where people would verbally accept, and then they'd go quiet, or during their resignation period, they'd accept another offer. So it's definitely been a very challenging market for those people who've been trying to recruit. When we look at the average time to fill, the whole cohort, it was the most common was 6 to 10 weeks, with about 27% of people telling us that they'd recruited their role in 5 weeks or less. That was much worse for people in clinical research. Only 15% managed to fill a role in less than 5 weeks or less. So it's definitely blowing out. Up to 10, 11 to 15, up to 3 months is not unusual to try and have that. And I think the data, I mentioned a few moments ago that over 50% of managers had extended an offer that had been declined. And when we looked at the candidates who had been job searching, they also indicated to us that 55% of them had received more than one job offer. I think what's interesting when you look at it from a pay increase perspective, people in clinical research, when they had changed jobs and they had got a pay increase, the average pay increase was 17 to 18%, which is very high. I'm not sure if that's sustainable, but it's definitely what we were told. I won't labor this point because I think I'm preaching to the converted, but people indicated that it was retaining talent definitely became more difficult than normal. Just moving on to the next slide, remote working. I think this was really interesting for me because I was full of admiration during COVID for my clinical research clients and also in commercial sales and marketing, who have for many years been managing a workforce that has been remote and not always in the office. When we asked employees about their preference and what they'd like, about 73% of the total cohort said they would actually like a mixture of working in the office and home. When you drill down to clinical research, that's about 63% would ideally want a scenario. So people don't want to be at home all the time. They do like being in the office and connecting with their colleagues and their managers. I think what was also interesting, looking at the right hand of the right slide here, what are managers' preferences? Overall, 30% of managers would prefer to decide on a case-by-case basis, and 10% would like people in their office, say 4 days a week. It was interesting that it was actually slightly higher for clinical research managers. They would actually prefer their staff in the office slightly more, which is really interesting given the nature of the work. And there was quite a high percentage of people who said, I have no preference and my staff can choose how often they come. So I think this is something we're going to see to play out depending on company policy, or if it's a individual manager's policy. It's definitely going to be in 2022. I think we'll see some settling there on is that going to be a retention or attraction strategy on what is the company's policy or the managers or the team's policy on offering working from home and how flexible. I think it was also really interesting. Managers indicated to us that who previously said no, they wouldn't consider employing somebody remote based had definitely increased during the second lockdown compared to last year. Living with COVID, productivity engagement, it was very high, and it was the same in clinical research. I think productivity was not an issue for everybody working in clinical research. It was 71%. Remained the same or had increased significantly. So it was very positive, both from a team engagement perspective and a productivity perspective. I'm drawing to a close here, but I suppose well-being at work, that was interesting. Moderately stressed, 84% of people said they were moderately stressed, and 10% extremely stressed. I think what we noticed was slightly different for people who were managing clinical research. There was definitely amongst the people leaders in clinical research, they had a higher score where they said ensuring the well-being of my team was one of the biggest challenges they'd faced compared to other cohorts. So I'm not sure what that reason was, but it's definitely something that managers were worried and really felt that the well-being of their teams during the lockdowns was an issue and something they were trying to address. We had noticed anecdotally the number of hours for managers had increased during last year and this year's lockdowns. Border closures, majority of people indicated that the border closures was not an issue. We're obviously starting to see this as, sort of being replaced now. At the time of the survey, the majority of companies did not have a vaccine policy. That is, and this we're still, I think we've only seen one international pharmaceutical company that, to our knowledge, has come out with a very clear vaccine policy. So we're just going to wait and see. It'll be interesting to see, does that cause any issues? We know anecdotally there's been a very high uptake in our life sciences sector, but you'd always be surprised on who says they won't. The border closures, we're hearing from clients that has really impacted, but when you drill down at the time of the survey, it didn't seem to be, it was just something people were learning to live with. And finally, sharing concerns of well-being. I suppose I'd like to just end on a positive note there, that if you're a people manager or not, overall, I think there's been a big shift. People will come either to their direct line manager or to HR about whether they're feeling stressed, if they're concerned for their mental well-being, or they feel unsafe. So it's the comfortable level and very comfortable level is positive. I think there's been a lot of talk in the media and with COVID, and it's definitely something that companies are doing very well, and this sector is doing exceptionally well. Okay. So questions. I would just like to, first of all, while you think about your questions, I would just like to say thank you so much. I really appreciate you logging on and listening to me for the last 30 minutes. As I mentioned at the start, everybody will receive a copy of the Salary and Job Satisfaction Survey with a link to this recording. If you feel any of your colleagues or other managers or in your businesses would also benefit, we are doing on the 8th of December, we're doing a webinar for all data or all sectors. However, during the next week, we are rolling out ones for regulatory, quality, commercial, executive. We brought forward our clinical research one because of the ARCS Workforce Summit that's happening next week. We didn't want to clash with that. But by all means, if you've any questions or you want to join again or you want to hear anything else, please don't hesitate. We're available at any stage now or in the coming weeks to answer any of your questions. But I'd like to encourage you, hopefully people, if you go to the chat function, I'm very happy to answer any questions that are out there. I don't see anything popping up. Is that, Miranda, is that popping up?
No, there's no questions as yet. So obviously you've done a very good job, Catherine.
Oh, that's good. Would maybe I could ask Lauren, could you just post a question to make sure it's working? Yesterday we had an issue. That's one of my colleagues at work. Yeah, we had this one yesterday with the medical affairs. No, I think.
Lauren, great work, Catherine.
Okay, thank you. That's good. So I can see that you're all digesting the information. And I welcome the opportunity to answer any questions you may have had. Hopefully what we shared today and the fact that you're going to get copies of the report is giving you reaffirmed what you're experiencing. And if you have any questions with respect to the salaries or people movement, or if that's not what you're seeing, I welcome the opportunity to have a robust discussion.
Okay, we've got a couple of comments from Susie. Thanks for a great presentation, Catherine. From someone else, we've got, is your data cohort from Australia?
Yes, it is. It's all from Australia. Yeah.
Another one, Miriam. Thanks, Catherine. Interesting presentation. So it looks like you have, what roles are hardest to recruit for, from Susie?
Hi, Susie. Yeah, great question. I think it's been the CRAs and the senior CRAs definitely been the feedback we've experienced as the most difficult, but also the feedback we're getting from clients and the time to fill. And not knowing, I think what's harder is not knowing whether you've got a person starting until they've actually started, because they may accept a counter offer or receive multiple job offers during that resignation period.
Have you seen any changes in the number of candidates coming from overseas, from Samantha?
Hi, Samantha. No, we've definitely seen some companies who've gone to the global visa talent pool, and anecdotally companies are trying to bring people in. We haven't seen a lot of people coming yet, but we're expecting it now with the borders opening. We did have clients that had candidates accepting job offers, and then when our borders shut, there was a nervousness. So we had clients where they lost a couple of overseas candidates due to our border closures. So we're not expecting that to be an issue going forward. But I do think the Global Talent Visa program, particularly for, say, clinical project managers, has made it easier. It's difficult to get people through on the current PR, but the 482 seems to be opening up, and we've been working with someone.
Okay, so we've got
Anjali.
Yeah, oh, you can see that now?
Yeah, have I seen any interstate movements? That's a fantastic question. Interstate movements, what we actually saw was people who'd previously considered moving or are now reluctant to move, or in fact, the fact that they couldn't get to Queensland to see their aging parents, or they couldn't get to Melbourne or Adelaide, has actually reversed it. So we're expecting to see now that once the borders open up, is people telling us they actually want to maybe move back home, and they're going to try and negotiate with their current employer to do their work, if possible, remotely. The lead time of starting a new position, yes, the data on that is, and you'll see that in the report, Zikong is definitely, it's blowing out from anywhere from 10 weeks to 15 weeks is the norm. From Nick, is the total remuneration package includes superannuation and car bonus correct? It excludes bonus. So when you're looking at the salary tables, that excludes bonus, but includes superannuation, base and car allowance. Hi, Candice. Do we have any data for biometric metric roles? No, in terms of clinical, we do have offline, but we don't have enough people who contributed for the clinical data management biometrics biostatisticians. So unfortunately, no, we didn't have enough contributors this year. From Maria, do you have any recommendation when it comes to recruitment, as the traditional models such as advertising on Seek do not seem to be working as well? Hi, Maria. When we drill down, it does seem that the feedback is that LinkedIn is working better than Seek in terms of clinical research. It's a better medium. This sort of majority of companies in clinical research seem to have moved away. I think the thing to know is that advertising on LinkedIn is different. It's a different value proposition. It's almost like having a billboard. So you'd probably your company would recommend that they talk to an account manager at LinkedIn. And there are an awful lot of companies posting LinkedIn jobs there. So it definitely seems to work more. Other companies were offering refer a friend bonuses and sign-on bonuses, but it's very much the long game.
And that seems to be it for now.
Wonderful. Does clinical research also include clinical QA or regulatory affairs? Regulatory affairs is a completely different sector. So in addition to clinical research, when you get the report later today, you'll see there's regulatory, medical, market access, sales, marketing, business development, executive research and development, laboratory and operations. With respect to clinical QA, we don't ever have enough data for that as a specific job title, unfortunately. But we have quality assurance, but the quality assurance sector would not cover clinical QA or clinical research. They always fall into a different category. Right. Anybody else got any thoughts or questions? Hi, Sarah. Do I have any data on the internal refer a friend fees paid by companies and how much they offer? We actually didn't ask that in the survey, but I can tell you it has increased significantly, and people may or may not want to comment. We have seen companies increase their refer a friend bonus from 5,000, some of them up to 10,000. 8. So the refer a colleague bonus is definitely anecdotally increased from what we've heard and seen. And so it's significant. Yeah, and it's probably 3,000 up to $10,000 is not unusual, and that's usually only payable after people complete their probationary period.
Well done. Oh, here we go.
Right. Is the standard notice period from Candice? It's interesting, Candice. We haven't seen the European trend of moving to 8 or 12 weeks yet. It's definitely, as you know, very common in our Europe colleagues, where it's a 3-month notice period. And typically in Australia, you only see the 8 weeks and the 12 weeks at the more senior executive level. I'm surprised that clients haven't started doing that, but it's sort of a net gain because once everybody does 8 or 12 weeks, then it has a knock-on effect. From Zcon, what do you see the trend in the coming year? The trend in the coming year, I think in my 30 years of recruitment, I'm predicting it's going to be probably one of the toughest years war for talent. Demographers in Australia are anticipating that our labour skill shortage will take until 2024, 2025 to recover. Because of the border closures and people going home, they've anticipated and worked out it'll be about close to 500,000 people. I think I'm talking to my colleagues in other life science recruitment companies overseas. It's a very similar trend. And I was sort of blaming COVID, was that everybody had banked up their work. But there is another piece of work, which unfortunately I can't reference at the moment, that is talking about this global shortage of talent has in fact been predicted for about 30 years with the aging workforce. That they were predicting an economic boom sometime in the mid-20s of 2020s. That this has not been unforeseen, but what happened has been we've been distracted by COVID and other things. So in fact, that this is being predicted. I think when you read my foreword, there's even on Q&A tonight on ABC, they're talking about the great wave of resignation. We're not necessarily seeing the great wave of resignation that'll happen next year. I think I'm predicting that maybe it'll be with a great wave of annual leave. I think a lot of people have banked up their holidays. A lot of people in Australia are dying to see family and friends either interstate or overseas. So I think people will probably want to stay put and travel and see family and friends. So if we're going to see the wave of resignations, I think they may happen later in the year, but I'm not entirely sure. If you look at why people leave, if they've got any frustrations, some of those frustrations have been negated by working from home. So I'm not sure. I think overall, I think it's going to be a tough 12, 18 months. And I'm not really sure what's going to happen with wages, to be honest. I think it's going to be really interesting to see. But we definitely already in our business see that we're getting calls from clients that we've known about for years but have never needed to use us. They're definitely calling us, particularly Australian companies that don't have their own HR talent acquisition. And they said 12 months ago they would have filled the role themselves in different categories. Now they're getting absolutely no response. So I think it's going to get worse. But I think the clinical research market and CROs have already been ahead of that game for the last 12 months and have been doing a lot of strategies to try and address that. Does COVID play an influential role in the statistics this year? Anjali, that's a great question. I think more so in the previous 12 months, we heard we heard from managers and clients that the ability to monitor and see sites was huge with travel and things impacted. So it was more the ability to do the job. Job satisfaction sort of was lower last year. It seems to have bounced back this year, but also remember we had reopened halfway through our survey. I actually don't know how much COVID is to blame and our borders being shut versus this economic boom that they've been predicting that maybe none of us were aware of, is what we're all seeing at the moment. I've still got quite a few people online. I love any other questions if anybody has anything they'd like to ask. Thank you, Candice. And of course, if you've got any questions once you get a copy of the report, please don't hesitate to reach out and email me. And as mentioned, if any of your colleagues in other sectors would like to join, we're rolling out this next week. And also there's the all data in the 8th of December. Okay, well, if that's it, if there's no more questions, I'll wrap up. Thank you very much again for taking the time to jump on this webinar and join myself and the On Q team. And again, thank you for your ongoing support of us. And I hope you find the report beneficial. If you've got any suggestions or feedback, please don't hesitate to reach out to myself or any of the On Q team. Thank you very much, everybody. Bye-bye.